Hello and welcome to the Vodafone Centre for Health Perspectives. I'm Katrina Lowes and I'm joined today by two wonderful health experts, and we'll be talking about the future of transformative technology in healthcare today and tomorrow. With me is Vine-Lott, who leads the Vodafone UK Centre for Health, and Professor Shafi Ahmed, award-winning consultant surgeon, teacher, innovator and technology entrepreneur. So welcome to you both.
Thank you.
Thank you.
At a time when waiting lists for elective surgery are longer than ever, with more than 7 million patients in the UK waiting for treatment, we've all seen the strain that healthcare providers are under. Today we'll talk about the role that digitalisation will play in creating more time for healthcare professionals to spend with patients. We'll talk about the importance of digital inclusion and democratising healthcare, the growing importance of personalised healthcare, and the role that innovation like the metaverse can play in helping more people gain access to the care they need when they need it. So Anne-Marie, why is supporting the health industry important to Vodafone?
So my background is from the NHS. I used to be a finance director in a mental health and community care trust. I guess having come from that background, you know the kind of fiscal constraint that these organisations are under, and actually how and what we do is really important in these next steps. And so I think a combination of that ongoing fiscal constraint, the situation where you have, for example, COVID, actually has been the ideal opportunity to have Vodafone, who already works as a strategic supplier across government, to lean in, if you like, to some of these problems and to help and to, if you like, accelerate some of the digital change that has come about with patients, with clinicians, with the workforce themselves, and actually help in that sector. So it's a perfect opportunity for Vodafone to come in. And then Deloitte as a symbiotic partner, if you like, because we've worked with them for some time across a range of sectors. They're trusted and for us, and so we wanted to bring their expertise into the frame.
So let's talk digital. I've heard a lot of talk about digital first in the health industry. Where do we start, Shafi?
So look, digitalisation has actually been quite important as it allows quick access to healthcare for patients, allows clinicians and healthcare workers to communicate better. Mm-hmm. And that allows patients' outcomes to improve. And also the efficiency of the system is much better as well. So a number of advantages with digitalisation that we've seen over the last few years. But on the other side, there's also the main challenges that we face, and that's creating a digital divide. And there's some data out there to reflect that. Look at the King's Fund report. It suggests that 16% of 18 to 25-year-olds don't have access to a computer or laptop, which is actually really surprising, right?
Wow, that's a shocker.
And moreover, 5% of the UK households don't have access to the internet. Mm-hmm. Again, it's a huge number of people across the country that don't have access. There's other evidence also to prove that. If you look at the evidence from, I think it's the Lloyds Bank Digital 22 report, it says that about 30% of people who are offline, for example, who have no access to internet, find the NHS really hard to navigate. So what we have to be mindful of is as we drive digitalisation, which has advantages, we should be very mindful of the fact that we might leave some people behind. So we have got to think very carefully about how we take the entire population together on that health journey, as well as digitising what we can.
So that's an interesting question, Anne-Marie. We've got two challenges there. We've got potential gaps in access as well as lack of confidence. And I think that leads us to a definite inequality in health. What is Vodafone doing to help address that?
So I think this is a good opportunity to mention our Everyone Connected campaign. This is where we've reached out to 1 million people to ensure that they actually have, whether it's through tariffs or free technology, that actually they have better access to care. And I think that's interpreting it in the widest sense. So healthcare is not just about, actually accessing services. It's also about helping people to access their banking, access their employment, access their, all of those other things that actually contribute to your entire health environment, if you like. So it's very much a system-wide thing, and also something that I think has to be done as part of a whole community and with partners. As we go forward with healthcare into the future, it is becoming far more of a mixed model. So you have got the private sector working with the public sector, working with the third sector. And if we think about what Vodafone is doing, working with charities, for example, and providing social value tariffs, and also enabling those charities to reach out to those who are most vulnerable, whether that's through education, with those who have learning disabilities and providing access to care. I think we're working with MenCap, for example, in that space workspace to be able to help with some of the individuals and enabling them to live better day-to-day lives and do better tasks through technology.
And if I think about my corporate world, when we introduce a new technology, I get training, I get support, I've got a help desk, I've got time to learn and change and practice my behaviour. Given the strain that healthcare providers are under, what is it going to take to introduce new technologies into hospitals in the UK?
I think you're right, there's a challenge. I think it's about education, number one. You have to empower the workforce to engage in technology and what that might mean for a patient journey or patient kind of experience, if you like. So I think that's the fundamental part. Also, I think digital technologies, we've almost not failed, but have not caught up with the rapid rise and what it might mean. There are issues around ethical considerations, around what data might mean. Are we having those conversations with all healthcare professionals to understand it better, to have the debates around some of these controversial areas sometimes? So I think it's about engagement, it's about education, and ensuring that what we do is also shown to be of value. There's no point in having these conversations, introducing technologies where there's been no value at the end. That means improving outcomes or experiences or whatever. So we need to demonstrate and validate some of the data to drive the change in people. So I think there's a number of things we can do to drive the kind of these technologies into the workspace and to allow the healthcare professionals themselves to be more empowered. That's also true of the patients, remember. We shouldn't forget them in this equation. And actually, how do we also support them through this new journey that they might be encountering? And how do we make sure they engage much better? So a number of things we need to do.
Can I pick up on the data component? Because I think one of the things that's really important in this is making sure that people feel the confidence to do that securely. So Vodafone for sure is working in the security space to enable individuals and businesses and NHS organisations to work together to share data. GDPR are obviously a challenge in some of that conversation, but actually that security aspect is really important, and that is a key enabler of what we need to do moving forward as well.
So the future of transformative technology in healthcare is so much closer than we think. Thank you so much, Anne-Marie and Shafi. Great conversation today. If you want to find out more about some of the stories that we've talked about here, check out our website. There's some really inspiring case studies of hospitals and healthcare providers that are adopting transformative technology already. And if you'd like to speak to our health team, the details are on the screen. Thank you, and we'll talk to you soon.